you think it's possible to achieve healthy, flawless skin without using creams or moisturizers? I do.
Oh, yeah. What? What you want?
Oh,
Come on.
oh, ooh.
Yo. Yeah. That's right.
What's your GSR kit?
And when you see such lovely faces and a beautiful face in studio, you know my next guest is Dr. Rachael Eckel. Welcome, cosmetic doctor. Always a pleasure to have you on the program.
Thank you for having me, Lisa, and good morning, beautiful Trinidad and Tobago.
I see you've worked with so many products here that we're going to be talking about. But first of all, you seem to have flawless skin. Is it possible to achieve, everyone to achieve flawless skin without having to use creams and moisturizers and so on?
That's a great question, Lisa. And many times we are sold these false advertising promises where, companies will tell us that buy this cream, use this system, and you're going to get beautiful, flawless skin and amazing results. Mm-hmm. But what we also know is that we purchase the cream and we see no benefits in our skin. So when we make decisions about skincare, we want to make the decision based on efficacy and based on results. We want to know that it works. And also, we want something that is cost effective and also that doesn't take 30 minutes that I'm rubbing on creams in the morning before I go to work, right?
Yeah.
So today we're going to talk about something really revolutionary, which is getting skin ready, which is brand spanking new.
Mm-hmm. And how do we get beautiful skin? How do we achieve this? Because some people will think that I will never have great skin. It's not possible.
So getting skin ready is a great way to achieve healthy, flawless skin. Now let's talk about what is the real secret to achieving beautiful skin.
Right.
Because you and I were born with flawless skin.
Right.
But as
Thank
we
you.
age, and you still have beautiful skin, as we age, we know that skin deteriorates. And the reason why skin deteriorates is because cellular function slows down. Mm-hmm. We get things like pollution, sun interfering with our skin. And so we see changes in our skin that we don't like. Now, what's important is that when we select products in order to help our skin, we want to select products that we know that work with clinical trials, with evidence backed by research and efficacy, so that we know that we're going to get results when we pay for these things. And it's important that getting skin ready is something which we're going to talk about today, is a great, easy, effective, cost-effective way for us to improve all skin attributes.
What is getting skin ready?
So getting skin ready, I'm so excited about this, is the first and most important step in any skincare program. Mm-hmm. I've been using it for 8 years now, and the benefits I've seen in my skin are tremendous. Mm-hmm. Getting skin ready basically consists of 3 very unique, easy steps. We cleanse with a designer cleanser twice a day for a minute.
Right.
We scrub our face once a day with an exfoliating polish for 60 seconds. Mm-hmm. And then we use an oil balancing toner twice a day in order to balance the pH of the skin and keep us oil-free throughout the day.
Okay.
All of my patients, this is how they start their skincare program. It's getting skin ready for the application of topicals and also for the day ahead.
Okay, so before I do makeup, I can do something like this.
Exactly.
Yeah. Mm-hmm.
So it's a very simple and effective program that takes basically 3.5 minutes to achieve.
Okay.
So 1.5 minutes in the morning, 2 minutes in the evening. And with this, we know that you can see real, tangible, beautiful results in the skin, evidenced by a clinical trial that we just performed.
Tell me about that trial.
Okay, so before I go into the nitty gritty, and I'm going to get a little bit nerdy and a little bit medical on you
because
right
you're
now.
a doctor.
But first of all, I want to spend a minute talking about the incredible researcher who performed the clinical trial.
Okay.
For those, some people may be familiar with her, some people not, but her name is Dr. Zoe Diana Draelos, and she is a professor of dermatology at Duke University in North Carolina. Dr. Draelos is the #1 dermatology researcher in the world. So most of the creams and products that we see in the pharmacy that are in our house, she has done the landmark clinical trials on these products and ingredients.
Yes.
So she's a superstar in the field of dermatology, and she's a superstar in basically calling a spade a spade. Is this working or does it not work? And really giving us the black and white on it.
Yes.
So Zeo Skin Health approached Dr. Drelos and said, we have a wild idea. We would like you to test cleansing, exfoliating, and toning. These 3 steps, and tell us what happens. And she looked at them with a little cut eye and she said, no moisturizers, no creams. This doesn't make any sense. You're not going to see any benefits. Patients are going to say their skin feels dry. I'm not sure if I want to do this. And they said, we believe in this because we've seen the results and we want to prove it.
Yeah.
So she started with a clinical trial, and basically she did a really comprehensive clinical trial. She basically had instrumental analyses of the skin, so using many different sophisticated tools like corneometers, cebumeters, cubometers. Then the other thing is that she had to assess patients' skin every 2 weeks. So they would come in and she would fill out a questionnaire based on what she saw with the skin. And the third metric was that at the end of the clinical trial, the patients had to say, did I see any improvement or not? And would I actually use these products
did
and
they?
recommend them?
What did they say?
I'm coming there. So she measured every single skin attribute. So every adjective you can think about with skin, whether it's pigmentation, roughness, dullness, dryness, moisturization, whatever you can think of, she measured it. And in 8 weeks' time, jaw-dropping results. Every single thing that she measured improved over 8 weeks. By as much as over 90% we saw improvements. And the patient satisfaction rate was through the roof. Now, when I heard her present this clinical trial live, and I heard her describe it, she said, in my career, I have never seen anything that's not a cream or a moisturizer that improved everything across the board.
Yes.
And it's 3 simple steps.
And it's the same 3 steps that we spoke about
Getting
earlier.
skin
Yeah,
ready,
yeah.
cleansing, exfoliating, and toning with the Zeo Skin Health System.
Do we have any before and after images that we can share with our viewers?
Sure. So what you see here, for example, with the image that was just shown, was actually a visio analysis of the skin, whereby we saw the improvement in roughness in the skin. You also see images where we can see improvement in pore size, in
Yes,
oil.
yes.
Some of the before and after images that you're going to see this morning of
Yes.
my patients here from the Skin Health Institute in Trinidad,
Yes.
where I'm based and located,
Yeah.
all of these results, whether it's acne, melasma, rosacea, large pores, discoloration, all of my patients, they all use Getting Skin Ready.
Yes.
It is the foundation to any effective daily skincare program.
But there are different skin types, doctor. So there must be different getting
Yes.
skin ready programs, are there?
Absolutely.
Okay.
So we know that there are basically 3 categories of skin. You have skin that is more oily and acne prone with large pores and breakouts. Then you have normal skin, which is also combination skin.
Right.
And then you have skin that is more dry or
So
sensitive
I have
or weak.
combination skin.
Yes,
Yeah.
you're a little bit more on the oilier side because you have large pores and you
Right.
also have some breakouts.
Right.
So, for example,
Why did I go there?
well, interestingly, Lisa,
yeah.
this, and I'm glad we went there because this is the most common skin type that we see in Trinidad.
Right.
Remember that our skin type here is very oily for 2 factors. One is that genetically, the darker ethnicities have larger oil glands, so they're more prone to oily skin conditions.
Right.
But in addition to that, our climate doesn't help. So the hot weather and the humidity activate the oil glands to make more oil. And it changes our oil into a more irritating substance that causes things like sensitivity, breakouts, large pores.
Right.
So the number 1 skin type in the Caribbean is oily skin. So the number 1 kit within Trinidad that we use at the Skin Health Institute that our patients use
Yes.
is the kit for oily skin.
Okay, so you do have different types of
Yes.
getting skin ready programs for different types of skin.
Yes,
Yeah.
and if you're not sure what your skin type is, At the Skin Health Institute, where Getting Skin Ready is exclusively available, we have very highly trained, internationally trained products experts that you can come in, you can have your skin analyzed, we can tell you what is the right product and package for you so that we can customize it to you and give you the very best maximum results.
Well, you're with us for a little bit, and as we wrap this segment up, there are specials for Mother's Day, right? There must be specials for Mother's Day. So we're going to take a break and come right back here with Dr. Rachael Eckel right here on the Now Morning Show.